Maternal mortality is considered a key health indicator, and the direct causes of maternal deaths are well known and largely preventable and treatable. The major complications that account for nearly two-thirds of all maternal deaths are severe bleeding, mostly bleeding after childbirth, infections, usually after childbirth, high blood pressure during pregnancy, that is preeclampsia and eclampsia, complications from delivery, and unsafe abortions. There is three delay model in maternal care. First is delay in decision to seek care due to the low status of women, poor understanding of complications and risk factors in pregnancy and when to seek medical help, previous poor experience of healthcare, acceptance of maternal death, financial implication. Second is delay in reaching care due to distance to health centers and hospitals, availability of and cost of transportation, poor roads and infrastructure, geography, for example, mountainous terrain or rivers. The third is delay in receiving adequate healthcare due to poor facilities and lack of medical supplies, inadequately trained and poorly motivated medical staff, inadequate referral systems. My journey started when I tried to reach Sangeeta, a pregnant lady living in a remote part of a village. I took the help of her father-in-law and asked where she stays. His father-in-law said she stays at a very far places along with her husband and children. So I asked him to show me the way. So we went on a motorcycle to that part of the village which is very far away. The road was very bad. It was purely a kacha road and very difficult to reach terrain. I met Sangeeta, who is a 30-year-old female and is pregnant for the fifth time, and she is 7 months pregnant. I check her vitals, in which her BP, such oxygen saturation, and random blood sugar came normal. I also look for the danger sign in pregnancy like high blood pressure or swelling of feet. I noted down all her details in my iPad. Maternal health remains a staggering challenge, particularly in the developing world. Globally, a woman dies from complication in childbirth every minute. I know that I can't solve all the maternal health challenges in the world by myself. I need and want others to join me. Maternal mortality health is a very sensitive indicator. All you need to look at is a country's maternal mortality rate. That is a surrogate for whether the country's health system is functioning. If it works for women, I am sure it will work for men. A huge proportion of maternal deaths and disabilities can be prevented through universal access to sexual, reproductive health and rights. When women take care of their health, they become their best friend. How can we improve the maternal health scenario in India? First, we need to place a high priority on maternal and child health services and integrate vertical programs like family planning related to maternal health. We need to give attention to care during labor and delivery, which is the most critical period for complication. We need to provide community-based delivery hubs which can provide a clean and safe delivery place close to home and maternity waiting rooms in hospital for high-risk mother. We need to improve the quality of maternal health care at the rural community level by proper history taking, palpation, blood pressure and fetal heart screening, risk factor screening and referral. We need to improve quality of care at primary health care level, for example emergency care and proper referral. We need to include in postpartum program for maternal health care and family planning services. We need to examine the feasibility of National Blood Transfusion Service network. We need to improve transportation. We need to educate young girls on health and sex. We need to informally educate the masses on maternal health care. We need to focus on obstetrics and gynecology training primarily on practical skills in the management of labor and delivery. We need to research reproductive behavior and we need to assure every woman the right to safe motherhood. I was quite happy that Sangeeta was doing quite well, but I don't know her future. I would definitely follow her up in near future.